What are the essential components of the informed consent process in radiologic procedures, and how should a technologist ensure that the consent obtained is valid and legally binding? Answer: the informed consent process is a fundamental ethical and legal requirement in healthcare, including radiology. The essential components include disclosure. The patient must receive sufficient information about the procedure, including its purpose, risks, benefits, and alternatives. This information should be provided in a manner that is understandable to the patient. Comprehension. The patient must demonstrate an understanding of the information provided. The radiologic technologist can assess comprehension through open-ended questions or by encouraging patients to express their understanding. Voluntariness. Consent must be given freely without coercion. Patients should feel empowered to ask questions or decline the procedure. Competence. The patient must possess the legal capacity to consent, which typically means they are of legal age and mentally competent. For minors or individuals with diminished capacity, a legal guardian or parent must provide consent. To ensure that consent is valid and legally binding, the technologist should verify that the patient's identity matches the consent form. Document the informed consent process, including the date and time it was obtained. Ensure that consent is obtained prior to administering any procedure or treatment. Guidelines from the American Medical Association (AMA) stress the importance of obtaining informed consent as part of patient autonomy and rights, ensuring that patients are active participants in their healthcare decisions. Describe the protocols a radiologic technologist should follow to ensure patient safety and comfort during a fluoroscopic procedure. What specific considerations should be made for patients with claustrophobia? Answer: to ensure patient safety and comfort during a fluoroscopic procedure, a radiologic technologist should follow these protocols. Preparation and communication. Explain the procedure to the patient in detail, addressing any concerns they may have. Use both verbal and nonverbal communication to reassure the patient and gauge their understanding. Monitoring patient comfort. Assess the patient's anxiety levels and previous experiences with similar procedures. Offer comfort measures such as blankets or the option to have the family member present. Patient positioning and support. Ensure that the patient is positioned comfortably and securely to prevent movement during imaging. Provide support devices such as pillows or straps to enhance comfort and maintain position. Radiation safety. Minimize radiation exposure by using the lowest possible dose while achieving diagnostic quality images. Employ lead shielding to protect the patient's sensitive organs when applicable. For patients with claustrophobia, additional considerations include offering a sedative. Discuss the option of a mild sedative with the referring physician if appropriate. Providing breaks. Allow the patient to take breaks if they feel overwhelmed during the procedure. Using open MRI machines. When available, utilize open MRI machines or less confining alternatives to reduce feelings of claustrophobia. The American College of Radiology (ACA) guidelines emphasize the importance of patient comfort and safety, advocating for a patient-centered approach to care. A radiologic technologist is conducting a routine chest X-ray when a patient suddenly becomes unresponsive. Describe the immediate steps the technologist should take to address this medical emergency, including the roles of basic life support (BES). Answer: in the event of a medical emergency where a patient becomes unresponsive during a radiologic procedure, the technologist should follow these immediate steps. Assess responsiveness. Gently shake the patient and call their name to determine if they respond. If there is no response, check for breathing and pulse. Call for help. Alert emergency services immediately. Use the institution's emergency code system or call 911, depending on the protocol. Activate emergency response. If the patient is not breathing or does not have a pulse, initiate basic life support (BLS) procedures. CPR, cardiopulmonary resuscitation. Position the patient on a firm surface. Begin chest compressions at a rate of 120 compressions per minute at a depth of about 2 inches (5 centimeters). After 30 compressions, open the airway using the head tilt chin lift maneuver and give 2 rescue breaths, ensuring chest rise. Use of ED. If an automated external defibrillator is available, apply it as soon as possible. Follow the voice prompts to deliver a shock if indicated. Continue BLS. Continue the cycle of 30 compressions and 2 breaths until emergency medical services arrive or the patient shows signs of recovery, such as breathing. According to the American Heart Association (AHA) guidelines, timely initiation of BLS can significantly improve outcomes in cardiac emergencies. The technologist must be familiar with institutional protocols for emergencies, including the location of emergency equipment and procedures for alerting medical personnel. What infection control procedures must be followed by radiologic technologists to minimize the risk of healthcare-associated infections? Discuss the rationale for standard precautions and its application in radiologic settings. Answer: Radiologic technologists must adhere to strict infection control procedures to minimize the risk of healthcare-associated infections. Key procedures include standard precautions: treat all patients and bodily fluids as potentially infectious, regardless of their diagnosis or presumed infection status. This includes the use of gloves, masks, goggles, and then gowns as necessary based on the procedure being performed and the potential for exposure to blood or other bodily fluids. Hand hygiene: perform hand hygiene before and after patient contact, after removing gloves, and before handling any equipment. Use alcohol-based hand sanitizers or soap and water, depending on the level of contamination. Environmental cleaning: regularly clean and disinfect all equipment, imaging tables, and surfaces according to the manufacturer's recommendations and institutional protocols. Ensure that high-touch areas are disinfected frequently, especially in between patient exams. Safe handling of contaminated materials. Properly dispose of shops in designated containers. Use biohazard bags for the disposal of contaminated waste, following local regulations and guidelines. The rationale for standard precautions established by the Centers for Disease Control and Prevention (CDC) is to provide a set of practices that protect both healthcare workers and patients from the spread of infections. These precautions are essential in maintaining a safe healthcare environment and preventing outbreaks of infectious diseases. MS. Thompson is a 72-year-old patient who requires a pelvic X-ray. She has limited mobility due to arthritis and is apprehensive about being positioned on the imaging table. What steps should the radiologic technologist take to assist MS. Thompson in a safe and comfortable manner during the procedure? Answer: to assist MS. Thompson safely and comfortably during her pelvic X-ray, the radiologic technologist should take the following steps. Pre-procedure assessment: evaluate MS. Thompson's mobility and any physical limitations she may have. Discuss her specific concerns about positioning and the procedure to alleviate anxiety. Explaining the procedure: clearly explain each step of the procedure and the importance of proper positioning for obtaining accurate images. Use simple language and confirm understanding. Providing assistance: offer physical assistance with transferring her to the imaging table. Use proper body mechanics to prevent injury to both the patient and the technologist. If necessary, utilize assistive devices such as a transfer belt or wheelchair to facilitate movement. Positioning on the table: gently guide MS. Thompson into the appropriate position for the pelvic X-ray, ensuring she is comfortable. Use pillows or foam wedges to support her back and legs, reducing discomfort and preventing pressure sores. Monitoring during the procedure: continuously monitor her comfort and pain levels throughout the procedure. Be prepared to make adjustments to her position if she expresses discomfort. Maintain open communication, reassuring her that she can pause the procedure if needed. By following these steps, the technologist demonstrates adherence to patient-centered care principles while ensuring MS. Thompson's safety and comfort during the procedure. The American College of Radiology (ACA) emphasizes the importance of patient positioning in obtaining high-quality images while minimizing discomfort. How can a radiologic technologist effectively perform a patient assessment prior to imaging procedures, and what specific factors should be considered in the assessment of pediatric patients? Answer: a thorough patient assessment prior to imaging procedures is critical for ensuring safety and achieving high-quality results. The radiologic technologist can effectively perform this assessment by following these steps. Medical history review: obtain a detailed medical history, including any previous imaging studies, current medications, allergies, and relevant medical conditions. Assess for contraindications related to the specific imaging procedure, such as allergies to contrast agents. Vital signs measurement: record vital signs, including blood pressure, heart rate, respiratory rate, and temperature. This information provides insight into the patient's overall health and readiness for the procedure. Physical assessment: conduct a brief physical examination, looking for any signs of distress, abnormalities, or conditions that may affect the imaging procedure, such as the presence of open wounds or skin infections. In the assessment of pediatric patients, specific factors to consider include developmental stage. Understanding the child's developmental level can help tailor communication and prepare them for the procedure effectively. Parental involvement: involve parents or guardians in the assessment process, as they can provide valuable information about the child's health history and any special needs. Age-specific considerations: recognize that pediatric patients may have unique physiological responses and different tolerances to procedures, requiring adjustments in techniques or positioning. The American Academy of Pediatrics recommends that healthcare providers use age-appropriate communication strategies to ensure understanding and cooperation during procedures. This patient-centered approach not only enhances safety but also fosters a supportive environment for pediatric patients. What are the key signs and symptoms of anaphylaxis related to contrast media administration, and what immediate action should a radiologic technologist take if a patient experiences a severe allergic reaction? Answer: anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur after the administration of contrast media. Key signs and symptoms include cutaneous symptoms, urticaria, hives, pruritus, itching, and angioedema, swelling of the face, lips, or throat. Respiratory symptoms, wheezing, shortness of breath, or difficulty breathing due to bronchospasm or laryngeal edema. Cardiovascular symptoms, tachycardia, hypotension, or dizziness, which may indicate shock. Gastrointestinal symptoms, nausea, vomiting, or abdominal pain. If a radiologic technologist observes signs of anaphylaxis during or after contrast media administration, the following immediate actions should be taken. Stop the administration. Cease the infusion of the contrast media immediately and ensure the patient is in a safe position. Call for help. Alert emergency medical services and notify the attending physician or radiologist immediately. Assess vital signs. Monitor the patient's vital signs closely to assess the severity of the reaction. Administer oxygen. Provide supplemental oxygen if the patient exhibits signs of respiratory distress. Prepare for emergency treatment. Have emergency medications such as epinephrine, antihistamines, and corticosteroids ready for administration as per institutional protocols. According to the American College of Radiology (ACA) and the Radiological Society of North America (RSNI), prompt recognition and treatment of anaphylaxis are critical to improving patient outcomes. The technologist should be familiar with institutional policies for managing allergic reactions to contrast media. Discuss the importance of age-specific care considerations in radiology, particularly when working with geriatric patients. What adaptations might be necessary to ensure their safety and comfort during imaging procedures? Answer: age-specific care considerations are crucial in radiology as different age groups have unique physiological and psychological needs. When working with geriatric patients, the following aspects are particularly important. Physiological changes. Geriatric patients may experience reduced mobility, decreased bone density, and changes in skin integrity, which can impact positioning and comfort during procedures. Cognitive function. Some elderly patients may have cognitive impairments or dementia, requiring additional patience and clear communication to ensure understanding of procedures. Medication interactions. Many elderly patients take multiple medications that may increase the risk of adverse reactions to contrast media or anesthesia, necessitating thorough medication reconciliation prior to imaging. To ensure safety and comfort, the following adaptations may be necessary. Gentle handling. Use gentle techniques for positioning and transferring to minimize discomfort and risk of injury. Extended time for explanations. Provide additional time for explaining procedures and obtaining consent, ensuring that the patient feels informed and comfortable. Support devices. Offer support devices such as walkers or handrails to assist with mobility and stability during transfers. Family involvement. Encourage the presence of family members or caregivers during the procedure for emotional support and assistance with communication. The American Geriatric Society emphasizes the importance of age-appropriate care to optimize outcomes for elderly patients, ensuring that their dignity and comfort are maintained throughout the imaging process. Explain the role of a radiologic technologist in the management of trauma patients presenting with shock. What specific imaging considerations should be taken into account in such cases? Answer: in the management of trauma patients presenting with shock, the radiologic technologist plays a vital role in providing timely and effective imaging services while ensuring patient safety. Key responsibilities include rapid assessment. Quickly assess the patient's condition and prioritize imaging based on the severity of injuries. Life-threatening injuries must be identified and addressed first. Collaboration with medical team. Work closely with the trauma team and follow protocols for imaging in unstable patients. Communicate any changes in the patient's condition immediately. Imaging considerations. Use appropriate imaging modalities to evaluate potential internal injuries, such as CT scans for rapid assessment of internal bleeding or fractures. When positioning trauma patients, use caution to prevent exacerbating existing injuries. Implement spinal precautions if a spinal injury is suspected. Monitoring and support. Continuously monitor vital signs and the patient's response during the imaging procedure. Be prepared to assist in the event of deterioration. The American College of Radiology (ACA) and the Radiological Society of North America (ARRT) recommend the use of trauma protocols that prioritize the assessment of critical injuries while minimizing delays in care. The technologist should be familiar with institutional protocols for managing trauma patients and ensuring a rapid response to their needs. How should a radiologic technologist approach the assessment of a patient's medical history and condition prior to an imaging procedure? Discuss the importance of identifying risk factors and pre-existing conditions in ensuring patient safety. Answer: a thorough assessment of a patient's medical history and condition is critical for ensuring safety and quality in imaging procedures. The radiologic technologist should approach this assessment by detailed patient interview. Conduct a comprehensive interview to gather information about the patient's medical history, including previous surgeries, chronic conditions, and allergies. Identification of risk factors. Identify risk factors that may affect the patient's response to the imaging procedure, such as age, weight, renal function, and history of reactions to contrast media. Reviewing previous imaging studies. Examine prior imaging studies and reports to understand the patient's medical history and the context of the current procedure. This helps in planning the imaging strategy. Pre-existing conditions. Consider any pre-existing conditions, such as cardiovascular disease or diabetes, that may influence the choice of imaging modality or the use of contrast agents. For example, patients with renal impairment may require alternative imaging strategies to avoid nephrotoxicity from contrast media. The importance of this assessment lies in its ability to enhance patient safety by preventing adverse reactions and complications. Ensure the appropriateness of the imaging procedure, allowing for modifications based on the patient's unique health profile. Facilitate clear communication with the healthcare team, improving overall patient care. The American Registry of Radiologic Technologists underscores the necessity of thorough patient assessment as part of professional practice standards, emphasizing patient-centered care that prioritizes safety and well-being. Explain the difference between the axial and appendicular skeleton and describe how fractures in each can impact overall human physiology. Answer: the human skeleton is divided into two main parts: the axial skeleton and the appendicular skeleton. The axial skeleton. This includes the skull, vertebral column, and rib cage. It supports the head and protects the brain, spinal cord, and thoracic organs. Appendicular skeleton. This consists of the bones of the limbs and the girdles, shoulder and pelvic, that attach them to the axial skeleton. Impact of fractures. Axial skeleton fractures. Fractures in the axial skeleton, such as vertebral fractures, can lead to significant implications including nerve damage, paralysis, or chronic pain due to spinal cord injury. Rib fractures may impair respiration and lung function, increasing the risk of pneumonia. Appendicular skeleton fractures. Fractures of the appendicular skeleton, such as in the femur or radius, can impair mobility and functionality, affecting balance and increasing the risk of falls. Complications can include fat embolism syndrome from long bone fractures and muscle atrophy from disuse. Discuss the mechanisms of injury for common fractures and the importance of imaging in diagnosis and management. Answer: common fractures are typically classified based on the mechanism of injury. Transverse fractures result from a direct force applied perpendicular to the bone. Oblique fractures occur from an angled force, causing a diagonal break. Spiral fractures often indicate a twisting injury and are commonly seen in sports. Comminuted fractures occur when the bone shatters into several pieces, usually due to high-impact trauma. Importance of imaging. Imaging techniques such as X-rays, CT scans, and MRIs play a critical role in diagnosing fractures. X-rays are the first line of imaging used due to their ability to quickly visualize bone alignment and integrity. CT scans. These provide detailed cross-sectional images, allowing for better assessment of complex fractures and joint involvement, particularly in cases of suspected intra-articular fractures. MRI. This modality is beneficial for assessing soft tissue injuries and bone marrow edema associated with stress fractures or occult fractures. Radiologic technologists must be adept at recognizing the type of fracture based on imaging characteristics to assist in appropriate treatment planning. Describe the mechanisms of breathing and how they relate to the pressures within the thoracic cavity. Answer: breathing or ventilation involves two primary mechanisms: inhalation, inspiration, and exhalation, expiration, inhalation. This process is active and involves the contraction of the diaphragm and intercostal muscles, expanding the thoracic cavity. As the volume of the thoracic cavity increases, the pressure within it decreases, Boyle's law, allowing air to flow into the lungs from an area of higher pressure, atmospheric pressure, exhalation. This process is primarily passive during normal breathing. The diaphragm and intercostal muscles relax, decreasing the thoracic volume and increasing pressure within the cavity. This pressure forces air out of the lungs into the atmosphere. Understanding these mechanisms is crucial for radiologic technologists, especially when performing imaging studies of the chest, as variations in thoracic pressure can affect lung inflation and overall image quality. Explain the role of myelin in nerve conduction and the impact of demyelinating diseases on nervous system function. Answer: myelin is a lipid-rich substance that insulates nerve fibers, enhancing the speed and efficiency of electrical signal transmission along the axon. Myelinated fibers conduct impulses via saltatory conduction, where the action potential jumps between nodes of Ranvier, leading to faster transmission compared to unmyelinated fibers. Impact of demyelinating diseases. In conditions such as multiple sclerosis (MS), the immune system attacks the myelin sheath, disrupting nerve conduction. This can lead to a variety of symptoms, including motor dysfunction, weakness or spasticity in muscles due to impaired signal transmission, sensory disturbances, numbness or tingling sensations resulting from abnormal signal conduction, cognitive impairments. Damage to myelin in the central nervous system can affect cognitive function, leading to issues with memory and processing speed. Radiologic technologists must be aware of these conditions, as imaging, such as MRI, is crucial in diagnosing demyelinating diseases and assessing disease progression. Mr. Anderson, a 45-year-old male, presents with sudden onset of severe back pain following a fall from a ladder. His medical history includes osteopenia. After an initial X-ray shows a potential lumbar vertebral fracture, a physician orders an MRI. What considerations should the radiologic technologist keep in mind when performing the MRI, and what potential complications could arise due to Mr. Anderson's condition? Answer: when performing an MRI on Mr. Anderson, the radiologic technologist should consider the following: patient positioning, ensuring that Mr. Anderson is positioned comfortably to minimize pain while maintaining alignment of the spine for optimal imaging quality. Screening for contraindications. Checking for any contraindications to MRI, such as the presence of metal implants or certain medical devices. Communication. Clearly explaining the procedure to Mr. Anderson, addressing any concerns regarding claustrophobia, especially since back pain might limit his movement. Potential complications. Given Mr. Anderson's osteopenia, there is an increased risk of fragility fractures. An MRI may reveal additional complications such as bone edema, indicating microfractures or stress fractures not visible on X-ray, soft tissue injury, identifying any associated ligamentous or disc damage that could exacerbate his condition. Proper imaging and patient management are essential in minimizing complications and facilitating appropriate treatment. Describe the flow of blood through the heart and the major vessels involved, emphasizing the significance of the cardiac cycle in maintaining hemodynamic stability. Answer: the heart functions as a double pump consisting of two circuits. The pulmonary and systemic circuits, right atrium, receives deoxygenated blood from the superior and inferior vena cava. Right ventricle pumps blood through the pulmonary arteries to the lungs for oxygenation. Left atrium receives oxygenated blood from the pulmonary veins. Left ventricle pumps oxygenated blood into the aorta, distributing it throughout the body. The cardiac cycle consists of systole, contraction, and diastole, relaxation, essential for hemodynamic stability. During systole, the ventricles contract, pushing blood out of the heart. During diastole, the heart relaxes and fills with blood. Significance: blood pressure regulation. Proper function of the cardiac cycle is critical for maintaining adequate blood pressure and ensuring sufficient perfusion to organs and tissues. Cardiac output. The volume of blood the heart pumps per minute is influenced by heart rate and stroke volume, impacting overall circulatory efficiency. Explain the role of the liver in digestion and metabolism and the implications of liver dysfunction on imaging studies. Answer: the liver is a crucial organ in the digestive system, responsible for producing bile, which aids in fat emulsification and absorption. Additionally, it metabolizes carbohydrates, proteins, and fats, playing a central role in maintaining homeostasis. Implications of liver dysfunction. Liver dysfunction, such as cirrhosis or hepatitis, can significantly impact imaging studies. Altered liver size and texture. Imaging studies may reveal hepatomegaly or changes in the liver's echogenicity on ultrasound, indicating underlying disease. Vascular complications. Conditions like portal hypertension may lead to the development of varices, which can be assessed via imaging. Liver function tests (LFTS). Understanding LFTS is essential for radiologic technologists. as abnormal results can indicate the need for more focused imaging studies to assess complications. Radiologic technologists must be aware of the liver's role in metabolism and how dysfunction can affect both patient management and imaging protocols. Analyze the functional anatomy of major muscle groups and their role in movement. How do injuries to these muscle groups affect overall mobility and daily activities? Answer: major muscle groups include flexors and extensors, located primarily in the limbs, responsible for bending and straightening joints, adductors and adductors, control movements away from and towards the midline of the body, essential for activities such as walking and balance, or rotators. Muscles that facilitate rotational movements, crucial in sports and daily tasks. Impact of injuries. Injuries to these muscle groups, such as strains or tears, can lead to decreased mobility. Pain and inflammation may limit range of motion, impacting daily activities such as walking or lifting. Muscle weakness. Following an injury, affected muscles may weaken due to disuse, requiring rehabilitation. Altered gait patterns. Compensation for pain or weakness can lead to abnormal gait, further increasing the risk of additional injuries. Understanding the implications of muscular injuries is crucial for radiologic technologists in evaluating musculoskeletal imaging studies and patient care. Strategies. Discuss the function of the thyroid gland and the implications of thyroid disorders on metabolic processes and imaging considerations. Answer: the thyroid gland plays a pivotal role in regulating metabolism through the secretion of hormones such as thyroxine and triiodothyronine. These hormones influence energy production, growth, and development. Implications of thyroid disorders. Hypothyroidism results in decreased metabolic rate, fatigue, weight gain, and sensitivity to cold. Imaging may reveal an enlarged thyroid, goiter, and necessitate ultrasound to assess nodule characteristics. Hypothyroidism causes increased metabolism, leading to weight loss, anxiety, and heat intolerance. Radiologic technologists may encounter increased blood flow and vascularity on imaging studies. In the context of nuclear medicine, thyroid function can be assessed through uptake studies, and knowledge of thyroid disorders is crucial for interpreting imaging results accurately. Evaluate the imaging considerations for assessing reproductive health in males and females, focusing on common pathologies and their implications. Answer: imaging modalities such as ultrasound, CT, and MRI are utilized to assess reproductive health. In males, common pathologies, conditions such as testicular torsion or varicocele can be evaluated through ultrasound, which is the preferred method due to its ability to provide real-time assessment without radiation exposure. In females, common pathologies, ovarian cysts, fibroids, and ectopic pregnancies are assessed using transvaginal ultrasound for better visualization of pelvic structures. MRI may be used for more complex cases. Implications for imaging. Patient considerations. Technologists must consider factors such as patient comfort, the necessity of explaining the procedure and any contraindications, especially in cases of suspected ectopic pregnancy, radiation exposure. Awareness of minimizing radiation exposure in reproductive imaging is critical, particularly for young females. Mr. Martinez is undergoing an abdominal X-ray, and the radiographer notices that the initial images show significant scatter radiation. The radiographer wants to reduce scatter radiation without compromising the image quality. What should the radiographer do to minimize scatter and improve image contrast, and why is this approach effective? Answer: to minimize scatter radiation and improve image contrast, the radiographer should consider using a grid. Grids are designed to absorb scatter radiation that is produced after the primary X-ray beam interacts with the patient's body, which can otherwise degrade image quality. Specifically, using a high-ratio grid, G10, 1 or 12, 1 would be effective because it filters out a greater proportion of scatter radiation while allowing the primary radiation to reach the image receptor. Additionally, the radiographer could reduce the field size by adjusting the collimator. Beam restriction collimation reduces the volume of tissue irradiated, which decreases the production of scatter radiation. This approach aligns with the ARRT as low as reasonably achievable principle, which is mandated by regulatory bodies such as the NCRP, National Council on Radiation Protection and Measurements. It helps reduce unnecessary radiation exposure while improving image quality by increasing contrast. Which part of the X-ray tube is responsible for accelerating electrons toward the anode, and how does its design contribute to the production of X-rays? Answer: the cathode, specifically the focusing cup and the filament, is responsible for accelerating electrons toward the anode. When a high-voltage kilovoltage peak, or kVp, is applied across the tube, the electrons are accelerated from the cathode to the anode. The focusing cup shapes and directs the electron stream, while the filament, when heated, Thermionic emission provides the electrons. The interaction of these high-speed electrons with the anode target produces X-rays primarily through bremsstrahlon radiation, break-in radiation, and characteristic radiation. The efficiency of this process depends on the material of the anode, typically tungsten due to its high atomic number and thermal conductivity, and the kVp applied. According to the ARRT standards, understanding the components and functions of the X-ray tube is essential for managing factors like image quality, exposure time, and patient safety. Explain the relationship between milliamperes kVp, kilovoltage peak, and exposure time in terms of image quality and patient dose. What happens if is increased but kVp is kept constant? Answer: the milliamperes controls the quantity of X-rays produced, while the kVp kilovoltage peak affects the quality, penetrating power of the X-rays. Exposure time determines how long the X-rays are emitted. Together, these three factors determine the exposure to the image receptor and the patient's dose. If is increased while keeping kVp constant, the number of X-ray photons generated increases, which enhances the overall image density. Brightness is reduced in digital systems, but it also increases the patient's radiation dose proportionally. Since kVp remains constant, the penetrating ability of the X-ray beam does not change, meaning contrast remains unchanged. According to 10 CFR 20 US Nuclear Regulatory Commission regulations, maintaining appropriate exposure levels is crucial for optimizing image quality while minimizing patient dose, adhering to the ARRT principle. Ms. Baker is undergoing a chest X-ray, and the radiographer adjusts the source to image distance, SID, from 72 inches to 40 inches. How will this change affect the image sharpness and the exposure index? Answer: decreasing the SID from 72 inches to 40 inches will have several effects on the resulting image. Image sharpness, spatial resolution. The sharpness of the image will decrease. A shorter SID causes a larger penumbra, blurred edges, because the X-rays diverge more before reaching the image receptor, leading to decreased spatial resolution. Exposure index I. The exposure to the image receptor will increase because of the inverse square law. The intensity of radiation is inversely proportional to the square of the distance from the source. So reducing the SID from 72 inches to 40 inches increases the radiation intensity at the image receptor, thereby raising the exposure index. This scenario illustrates how adjusting imaging parameters such as SID affects both image quality and exposure, reinforcing the need for careful technique selection as per ARRT standards. In digital radiography, Doctor, what is the significance of the exposure index I, and how does it help radiographers optimize image quality and patient dose? Answer: the exposure index I in digital radiography is an indicator of the amount of radiation that reached the digital detector. It serves as a feedback mechanism for the radiographer to assess whether the exposure was within the optimal range. A properly calibrated I helps ensure that the image quality is sufficient without overexposing the patient to unnecessary radiation. If the I is too low, the image may be underexposed, resulting in noise and reduced diagnostic value. If the I is too high, the patient may have received more radiation than necessary, even if the image appears diagnostically acceptable due to the wide dynamic range of digital detectors. Following the International Electrotechnical Commission like 624941 standards, EI is a critical tool for balancing patient dose and image quality. Describe how an automatic exposure control (EEC) system works in radiography and discuss its benefits and potential limitations. Answer: automatic exposure control (EEC) systems work by automatically terminating the exposure when the desired amount of radiation has reached the image receptor. ARRT detectors, usually placed between the patient and the image receptor, measure the amount of radiation and end the exposure once the preset level is achieved. Benefits: consistent image quality. ARRT helps achieve consistent image density by adjusting the exposure time based on patient thickness and tissue density. Reduced risk of overexposure. ARRT minimizes the risk of overexposing patients by limiting exposure to the necessary amount. Limitations: improper positioning. If the patient or the area of interest is not properly aligned over the ARRT detector, the exposure may terminate prematurely or be extended, leading to poor image quality or unnecessary patient dose. Following FDA regulations and ARRT guidelines, the use of ARRT systems must be accompanied by careful patient positioning and selection of appropriate technical parameters. Dr. Sanders reviews a digital X-ray of a patient's spine and requests that the radiographer adjust the contrast to highlight a specific vertebra. The radiographer suggests using windowing during post-processing. How does windowing affect the image, and why is it a useful tool in this case? Answer: windowing is a post-processing technique used to adjust the contrast and brightness of digital images by changing the window level controls brightness and window width controls contrast. By narrowing the window width, the radiographer can increase the contrast in the image, making subtle differences in tissue densities more visible. In this scenario, adjusting the contrast using windowing is useful for highlighting the specific vertebrate requested by Dr. Sanders because it enhances the visibility of fine details in a localized area of the image, improving diagnostic accuracy. According to ARRT image production guidelines, windowing is essential for optimizing digital image quality, especially in complex structures like the spine. In computed radiography, CR, what is the role of the photostimulable phosphor plate and how does it differ from traditional film screen radiography? Answer: in computed radiography, CR, the photostimulable phosphor plate, PSP, captures and stores the X-ray energy when exposed to radiation. This stored energy is later released as light when the plate is scanned with a laser in the CR reader. The light is then converted into a digital signal to form the image. Unlike traditional film screen radiography, where the image is formed immediately on the film, CR allows the image to be captured and stored digitally. The PSP can be reused multiple times, which reduces costs and enhances workflow efficiency. This transition to digital technology aligns with FDO's digital imaging guidelines, emphasizing the advantages of CR over traditional film screen systems in terms of post-processing, storage, and image sharing. Explain how a picture archiving and communication system, PACS, improves the efficiency of radiology departments and the challenges associated with its implementation. Answer: PACS is a medical imaging technology used for storing, retrieving, presenting, and sharing images produced by various imaging modalities. It improves efficiency in radiology departments by immediate access. Clinicians can access images quickly from any location within the healthcare system, enhancing diagnostic speed and reducing patient waiting times. This is particularly beneficial in emergency situations where timely decisions are critical. Digital storage. It eliminates the need for physical film storage, which reduces space and costs associated with film development and maintenance. Digital images can be stored more compactly and can be easily backed up for disaster recovery. Integration with other systems. PACS integrates with radiology information systems, RIS, and electronic health records, AIR, streamlining workflows and improving communication among healthcare professionals. This integration allows for better patient management and enhanced collaboration. Enhanced image manipulation. Radiologists can apply advanced image processing techniques, such as adjustments in contrast, brightness, and zoom directly on the digital images, leading to improved diagnostic capabilities. Challenges. Cost of implementation. Initial costs for setting up a PACS can be significant, including expenses related to software, hardware, and training personnel. Budgeting for ongoing maintenance and updates is also necessary. Data security and privacy. Ensuring the privacy and security of patient data is critical. PACS must comply with regulations such as HIPAA, Health Insurance Portability and Accountability Act, which can require significant investment in cybersecurity measures and staff training. User training. Staff must be trained to use the PACS effectively. Resistance to change from traditional film-based methods can hinder implementation, and ongoing education is required to keep up with technology advancements. In alignment with the UT's technology standards, effective implementation of PACS requires careful planning, investment in infrastructure, and strategies for overcoming potential challenges to maximize operational benefits. What are common types of image artifacts encountered in digital radiography, and how can radiographers minimize their occurrence? Answer: common types of image artifacts in digital radiography include motion artifacts, caused by patient movement during exposure, leading to blurriness in the image. This can significantly reduce diagnostic quality. Phantom images occur when residual energy remains in the imaging plate from previous exposures. These ghost images can confuse interpretation. Grid lines may appear if the grid is not properly aligned or if the grid frequency is similar to the sampling frequency of the imaging system, which can obscure diagnostic details. Aliasing artifacts result from insufficient sampling of the image data, leading to false patterns or wow effects. This often occurs when the imaging frequency approaches the Nyquist limit. Image dropout occurs when certain areas of the image are missing due to detector malfunction or issues with the acquisition process, resulting in incomplete visual information. To minimize these artifacts, radiographers should ensure patient cooperation, use effective communication and immobilization techniques to reduce motion, Additionally, using faster exposure times can help minimize motion effects. Proper equipment maintenance. Regularly maintain and calibrate imaging equipment to prevent phantom images and dropout, ensuring that the photostimulable phosphoplate PPSBS are correctly processed and stored also helps minimize residual images. Grid alignment. Check and calibrate grid alignment before each exposure. Understanding the grid frequency and matching it with the imaging system sampling frequency can help avoid grid line artifacts. Proper exposure techniques. Adhere to the principles of optimal exposure settings to minimize the risk of aliasing artifacts. Understanding the digital detector characteristics and selecting appropriate settings based on patient size and imaging requirements is crucial. Training and education. Regular training sessions for radiography staff on identifying and managing artifacts will enhance their skills in minimizing their occurrence. Familiarity with common artifacts and their solutions can lead to better image quality.